I am Diana Merriam. I am the chief economist of the Economy Conference. I am also the host of the Optimal Finance Daily podcast, where it is a daily show, narration style podcast, where I serenade you with the sweet sounds of personal finance knowledge. So feel free to subscribe to that if you like. As I mentioned, I just bought my own health insurance off the exchange. And when I quit my job, the number one question that I got was, oh my God, what are you doing about health insurance? I mean, that I'm telling you is the number one question. And in my head, I'm like, well, it actually really wasn't that bad. So I wanted to share the information that really helped me in this process. And I brought in two leading experts that I will introduce you to in a moment. We also have Josh. Josh Overmeyer is our master moderator. He's going to be keeping an eye on the chat to help with your questions today. He's also going to guide us in the Q&A portion of today's presentation. So as we're talking, you feel free to pop your questions in the chat feature, and Josh is going to make sure that we get to them at the end of our presentation today. So our first expert guest is Lynn Friar. She's a nurse and she's the founder of FiHealthcare.com, which is the largest crowdsourced knowledge base on health insurance options in the US. After a brain tumor in her 20s wiped out her savings, what we're all terrified of, right? This brain tumor wiped out her savings and she rebuilt her investments to the point where passive income overtook her nursing wages. And she was able to make work optional at the age of 39. So Lynn has been here. She has figured out health insurance for her family, and she is a leading expert on this topic. So welcome, Lynn.
Thank you, guys. I am thrilled to be here. I definitely want to encourage folks, pass on the knowledge that I've learned, and bring us all together because I think crowdsourcing is the best way to do it.
Awesome. We also have Angel Salucci. Angel is a nurse practitioner and founder of Overtook Consultants. She has 40 years of experience working in the healthcare system, and she is on a mission to educate, equip, and empower people to become better consumers of healthcare. Angel helps people ensure that they are receiving medically necessary treatment at fair and reasonable prices, which is the first line of defense against medical fraud, waste, and abuse, which currently robs us all of an estimated $80 billion every year. Yeah, you read that right. $80 billion every year. And Angel is here to talk about that today. So thank you so much for joining us, Angel.
Thank you. I'm so excited to be here. Can't wait to hear everything Lynn has to say because insurance overwhelms me. That's not my forte. But, you know, it's funny when I hear that, oh, I've been in healthcare over 40 years. I started out at 13 as a candy striper. I'm not like, 105, even with the white hair. But yeah, so anyway, it's my passion. Once I realized the impact it was having on my friends, my community, because it's all of us, the taxpayers who fund Medicare and Medicaid. Not to mention, we have over 30 million people right now without health insurance.
Yep.
Since COVID hit. So, yeah.
Absolutely. Well, thank you for that. And what I find really exciting about today's presentation is we're going to talk about healthcare from a couple of different angles. So firstly, and this is something that's discussed a lot, what do I do about health insurance? How do I properly insure myself? That's a big question, and we're going to address that today. But secondly, how do you prevent, address expensive medical bills? Even when you're insured, when that big bill comes, what do you do? And that's why we have Angel here with us today to kind of help us hit it from that new angle that we haven't really heard a lot of people talk about. So our agenda today, I am going to guide a conversation with Lynn and with Angel for about 45 minutes. We are 8 minutes into that with quick introductions. We are also going to do 15 minutes of questions and answers at the end, Q&A at the end. So ask your questions in the chat as we're talking, and Josh is going to keep an eye on that. So to kick us off, I'd love to start with Lynn. Lynn, we see that for entrepreneurs and people pursuing financial independence, that the cost of health insurance and lack of good options is just a huge concern. Can you take a moment to talk us through some of the most common options for people who buy their own health insurance and what we need to be mindful of when it comes to costs?
Absolutely. So I would say the vast majority of people are going to elect sort of what they call the ACA plan, the Affordable Care Act. And that is something that you get by going through healthcare.gov. It's our government organization, and it will take you to your state specific site. I recommend people go in incognito mode and just look at what they have. I think sometimes we just make assumptions about what's available or what's not available, but just go in, and I say incognito mode because once they get your phone number and email address, you'll start to get lots of advertising. And so for the vast majority of people, that is going to be a great place to start to see what you have. And the three things that you should look for is, what is your premium, which is your monthly cost? What is your deductible going to be, which is how much you will have to pay before any insurance kicks in? And how much is your out-of-pocket max, which theoretically, if you add your premium and your out-of-pocket max, would be your total cost. There's some exclusions to that. But I recommend people just start looking. I think they're afraid to look. I also do want to say Health Sherpa is a great alternative in many areas for healthcare.gov, which is a government site. Health Sherpa is a private site. And I used to recommend eHealth Insurance, but it seems like they don't have as much coverage or as much configuration. But there are I have a website called fihealthcare.com where I look at 22 options, and the ACA, healthcare.gov, is just one of the ones I mentioned, but it is by far the most common one that entrepreneurs, early retirees, and folks pursuing sabbaticals will start. So I recommend starting there to see what is in existence now. Yeah. And as far as planning for the future of that, take a look at what is now. And we have a lot of actuaries estimate an increase in cost of healthcare of about 5.4% per year. So take a look, getting a start at what is there now, because we can't project what the future will be in politics. And, we could talk a little bit more about that later. But starting with what is now is a great place to start.
Got it. Well, thank you so much, Lynn. And just to give you guys an example, I'll use myself as a guinea pig of how that worked out for me, because I followed Lynn's advice exactly. And I went on to healthcare.gov. I also went on to Health Sherpa. That's ultimately what I ended up going through. It's just a nicer interface, but I actually found the same information on Health Sherpa as I did on healthcare.gov. And what I did is I just looked at the options, and I ended up choosing, there were only about 9 options that allowed for me to invest in an HSA, which was really important to me because investing in an HSA is something that I've been doing through my employer-sponsored plan, and I wanted to continue doing that. I'm also a very low utilizer of healthcare. So when I think about my employer-sponsored healthcare, the deductible was $1,500 a year. I never met that deductible because I never really have needed to. And so when I looked at the deductible and out-of-pocket max for the plan I ended up selecting, which was the lowest cost plan that allowed an HSA, it was actually a $6,900 deductible, and that number was also the out-of-pocket max. Now that sounds like a scary number, right? $6,900, like that's but looking at that was also the out-of-pocket max gave me some assurances that I knew that that's probably the most that I'm going to pay if something terrible were to happen and I had to utilize my health insurance, right? So how much was this plan? It's $285 a month, which I'm in Ohio. Maybe we just have good options. It is state specific, which is why Lynn is advising to go in and look at what you are offered for your location. But that's what was offered to me. Now, if you make under 50 grand a year, you also may be eligible for subsidies, right? And so I don't know what my income is going to be. Maybe I'll make 25 grand this year. Maybe I'll make 200 grand this year. I'm flirting with self-employment, right? Who knows what it's going to be. And so if what I was offered was to reduce my $285 a month by, if I estimated I was going to make, 25 or 30 grand this year, I could reduce that cost with subsidies. I actually opted not to do that because I don't know what my income is going to be. And if it was above that 50 grand threshold, I would have to pay all that subsidy back. So what I ended up doing is not applying the subsidy. And then if it turns out that my income is very low this year, I will be able to recoup that when I do my taxes. The other thing that I did is for dental insurance, which I don't know if there's too many questions about that today, but I opted to go with the COBRA that was offered from my employer. And the reason was because I think I might have something that needs a crown this year. Typically, health insurance for dental or dental insurance isn't really worth it unless you know you have major work that you need to get done. And so that's why I just opted to take the Cobra. It's $48 a month. I figured why not, be safe than sorry on that point. So that is how it worked out for me. If you're curious, other thing I wanted to mention, if you are currently investing in an HSA, that to me gave me the assurances that I was going to be okay, because I knew that I had well over that $6,900 deductible in my HSA. So that gave me a lot of assurances that no matter what happens based on this healthcare plan that I bought, that I should be okay. Okay, so
yeah, Diana, I had a couple of really, I think, helpful points of clarification.
Sure.
So for folks, COBRA, the Consolidated Omnibus Reconciliation Act, entitles folks to coverage for medical and dental for 18 months and sometimes longer, depending on your state, after you leave employment. And so that's worth looking into. And in some cases, it will make sense. In a lot of cases, it'll be very expensive because you'll take over the cost of your employer coverage plus some sort of administrative premium on top of that. And since employers pay about 84% of the cost of your healthcare when you're employed, you can imagine that will go up quite a lot. So, but something really worth looking into, since you can carve out dental sometimes. And so it's an option to consider. People immediately discount it. But if you've already met your deductible for the year, there are some cases where it will make sense. Yeah. And
thanks for that, Lynn.
Another really quick thought. People often talk about the premiums and with the fire community and getting adjustments based on that. So you don't have to take the deduction of the premium if you are feeling like you don't want that. You don't want the subsidy because of moral reasons or ethical reasons because you have a net worth. That is optional, absolutely optional to take the subsidy. So I just wanted to mention that.
Awesome. Thank you. Yeah. And I opted not to take that Cobra insurance because it was over $600 a month for me to continue on that health insurance. So I opted for buying it off the exchange. Cool. So would love to move over to Angel now. Now, Angel, for those of us that are able to get past that insurance hurdle, there's still this fear of like, what if my insurance doesn't cover something and I get a big bill? What do I do if I get that big bill?
Well, I think it's pretty safe to assume there's always going to be something our insurance carrier is not going to cover. So that is going to come into play at some point. So I'd like to speak to that, and also people who don't have insurance and you're going to get this big bill also. The first thing I would say is don't panic. I know that's easy to say, but honestly, you don't have to pay for anything until you understand and agree with everything. It's not as if you get the bill and you're like, oh my gosh, I have to pay this. No, you don't. You have to do your due diligence first. And I always look at medical bills as if they are guilty until proven innocent. Opposite of our legal system. That sucker is guilty until I verify it, that it is accurate. So you want to do, when I say do due diligence, is that you want to make sure it's accurate, because even the smallest mistake could mean the reason why your insurance carrier didn't pay something. For example, I'm dealing with something now. It was definitely a needed medical test, and my insurance carrier is saying that it was not medically necessary. Well, first of all, you can't tell me, a nurse practitioner, something wasn't medically necessary. I'm going to fight you on that. So here it was my provider who did not code it correctly, her office. They were so apologetic. But you have to be, like I said, do your due diligence, and you want to be able to read your medical bills. You want to check your name. You want to check the date of service, because it could even be that, the date of service was incorrect. You want to make sure that what you received is what you are being billed for. And if the insurance carrier is saying that they're not going to pay for something, you then want to go to your provider and say, why isn't this being covered? It could have been a documentation thing, And then if everything's correct, there's no errors, and you do indeed owe that money, then you want to decide how you're going to handle it. So do you have to go on a payment plan with the provider? Reach out to the provider, reach out to the hospital. Everything is negotiable. Everything is negotiable, however you say that. Or if that's too big of a word for you, questionable. You can question everything. You have the right to ask as many questions as you want. And while you're in that dialogue, you don't have to worry about debt collectors or anything like that. Side note, always put it in writing. I tell people, don't spend 4 hours on the phone. Your time is just as valuable as theirs. Put it in writing. I am questioning these charges for this date. I think it should be covered, whatever it is. put that in there, send it certified, return receipt requested through the mail. And by law, they have to reply within 30 days. And it's not like they could send you to a collection agency during that time period. So you do have time to breathe, to collect your thoughts. I mean, for crying out loud, you're already dealing with whatever it was that gave you the bill to begin with. So just pause and realize that you are in total control of this, even in regards to how you're going to pay it. Don't ever put it on a credit card, because why should you incur interest? So you may want to go on a payment plan with the hospital. And if all you can afford is $50 a month, that's all you can afford is $50 a month. You may need to declare financial hardship, and that's okay also. You're going to write them a letter and you're going to say, hey, this bill for $10,000, I can't afford this right now. My mortgage is this, our food bill is this. I've got 3 kids at home, but I am willing to do blah, blah, blah. As long as they see that you are trying to pay what is indeed your responsibility. And the first step, I guess I should say, for those of you with health insurance is make sure that you know what your carrier covers and doesn't cover, because that is ultimately your responsibility. We need to know which providers can we go to, which hospitals can we go to, which services can we get. And that comes in, the book that I even throw in under the dresser or under the drawer each time it comes in, where it explains your entire plan. But you really need to know that. And then that will help you stay in network or whatever it is. It helps you to play within the rules. And then if I'm playing by the rules, you darn well better pay for what I'm paying premiums for. You know what I mean? So, but I think that's my big message is you have more control than they want you to think you do. And I'm here to tell you, you do.
Well, I got to tell you, Angel, I am shocked when you started educating me on just how extensive medical billing mistakes, fraud, abuse actually is. Can you tell us kind of what are the most common mistakes that you see in bills? And, you're a nurse practitioner. Of course, you look at a bill and say, I know this is medically necessary. But when I get a bill, I just see a bunch of codes and the description is something I don't understand. So how would you advise someone like me that maybe isn't as knowledgeable about what's medically necessary?
So, well, medically necessary, that is the conversation you want to have with your provider while you're in the office. That's where you determine if this treatment is medically necessary. In case in point, I had hurt my back a few years ago and my provider wanted me to have an MRI. And I'm like, I knew it was going to cost me $1,200. So I said to him, well, why are we doing this? And he was kind of vague. So then I'm like, and this was before I was an NP, I'm like, well, is it going to change the treatment plan at all? Is it medically necessary? He's like, well, not really, but it probably would be a good thing to have on your record. I'm like, well, not really isn't good enough for me for exposure to radiation. And also I'm not incurring that cost just because. So that's where the dialogue comes in, where you want to know, is it medically necessary? And please, folks, goodness, I can go on and on, but especially if you have elderly parents or you're elderly yourself, hospitals are incentivized. Providers in the ER are poor providers. They're incentivized by the administration to over-test, over-medicate, over-treat, over-admit anybody over the age of 65 because they're all typically on Medicare. And that's a blank check. They can do and charge whatever they want for that. So always be cognizant and ask the right questions as to whether or not something is medically necessary. Now, in regards to your bills, you get a bill. If it's a bill for like $50, if that even exists, and you can understand what it is, then, I wouldn't pay too much attention to it. But if I get a bill that's over, let's say $1,000, I'm then going to request an itemized bill. And an itemized bill is where you get all the codes. And if you don't know what a code is and they don't give you a description, then go to the most popular doctor on the planet, Dr. Google, and just put in the code and say, what is this code? Because the code means CPT code, which represents a current procedural treatment. So that will tell you exactly what they did. And then you can say to yourself, as you're looking at your bill and you see this code, oh, that's a right shoulder x-ray. And then you're like, wait a minute, I didn't have a shoulder x-ray. So then they're billing you for something that was not delivered. And that's one of the 4 things we see a lot of, people billing for services that were not delivered. Okay. So one of my funniest favorite examples I give people is that when we were reviewing medical records for a gentleman, he was charged 2 times for a pap smear.
Oh my God.
Like, let's let that sink in. And it could be a simple human error where they just, flip the numbers by mistake, because these are humans putting these numbers in. We all make mistakes, So speaking of mistakes, that's one of the biggest ones that my team and I found. And we have 25 years worth of data that we're looking at. And the data we looked at showed us that 9 out of 10 of the medical bills that we reviewed contained errors. Now, granted, if they're coming to us, they already suspect that there's some kind of errors. But even friends of mine and my own bills, we're seeing these same errors. The other thing would be to double bill. Now, when you say double bill, it's not just 2 office visits, but let's say you had a surgical procedure. A friend of mine had a same-day procedure. I knew what he had done. I'm looking at his records. And I said to him, I called him and I said, how many IVs did you have? And he said, 1. Why? I said, okay, because you were billed for 6. That's considered double billing. The other one is for upcoding. That would be if you saw your doctor for a sore throat and they billed you for a pneumonia. Higher acuity level, they can charge more money, they get paid more money, but that's all coming out of our system in itself. And then the 4th one, which is kind of hard to identify, is called unbundling. And that is when they parse out and they charge you for every single solitary thing. So a good visual of this is if you went to a fast food restaurant and you ordered a value meal and they said, okay, that'll be $72. And you're like, what? Well, sure, because they're going to charge you for the cup, the straw, the ice, the lid, the burger, the 1 pickle. They're parsing out every single thing. That is really, really common in surgical procedures. They do that a lot. So those are the 4 things that you would want to really keep your eye on, and just read your medical bills. And I tell people the step before that, start documenting it. Because if I read my bill and I'm like, well, and then I try and, debate it with them, they're going to say, well, no, you had that done on that day, and I'm only relying on this. Heck, I can't remember what I had for lunch yesterday, and I'm only going to remember what's in my mind. No, you pull out your notebook. No, on this day, this date, I had this, this, and this. Like, that's taking your power back by documenting ahead of time before there's even an issue. So document, and then you're going to review, verify that your bills are correct, and then you take it to the next step and you decide, okay, now what am I going to do with this bill? Do I have to declare hardship? Do I need a payment plan, or do I just outright pay it?
So interesting, Angel. And I gotta, when we're talking about medical billing fraud and abuse, it sounds so malicious, right? I mean, I think it seems partly like it's just mistakes. It's human error in a lot of these things. What is the difference between fraud and abuse? And can you just quickly give us maybe an example of what we're dealing with here? I remember hearing you on a podcast and you gave a great example about tissues and how that was built.
Yes. Okay. So abuse is intentionally, I'm sorry. Abuse is when you are raising your prices more than you should. Or like, for example, the box of tissues. Now, if you are admitted into the hospital and you get your itemized bill, you're going to see that you were billed like $25 for a mucus recovery system. So, us, common folk, we're going to be like, oh my gosh, I had a mucus recovery system. It's a box of tissues. Now, it's not fraud because you did get the tissues, but it's abuse because they knowingly raised their prices to get more for that item. And hospitals are notorious for raising their prices 400 to 500%. Where else is that accepted? Well, it's accepted anywhere else where the people aren't really being vocal about it, which that's going to stop. That's like my whole mission here. And then fraud is knowingly and intentionally trying to get paid for something that you are not entitled to. That would be the upcoding. That would be the double billing. And you're right, Diana. I always like to come at it from a position of, you know what? We're all human. We make mistakes. I'm never going to accuse somebody of fraud right off the bat. I'm going to give them the benefit of the doubt. So even pharmacy fraud's a big thing. If you order prescription medications, 90-day supplies, make sure you're counting every one of the pills, because they could be skimming some off the top, and that's not good. That's considered fraud. That happened to me twice. And both times I went back to my pharmacist and I'm like, you know what? I know you're so busy, but you shorted me 8 pills. Could you just give me my 8 pills? You want to go back the same day, but you always want to give people the benefit of the doubt. And can I also just say one more quick thing? I don't want people to be against the medical system. I really don't. I'm a provider. I don't want that. I'm fighting for our nurses, our providers, our nurse practitioners, all the people who are not being paid appropriately and who are working their fingers to the bones, being told what they can and cannot do for their patients and how much time they have to spend with them. Meanwhile, we have CEOs making gajillion dollars, like $14, $15 million a year off the backs of these worker bees and off us, the people that the system was designed to serve. So that's where my disgruntling is. Same way we have good and bad police, good and bad teachers, we have good and bad providers and good and bad hospital situations, administrators. So my whole thing is I want to empower people to be more in control, more autonomy in the healthcare system, and more power to question and hold people accountable. So that's my whole thing.
Thank you, Angel. Well, I feel empowered. That's just incredible. I've never heard anyone talk about medical billing the way that you do. And clearly you're very passionate about it. So thank you for being a woman on a mission, because I can see that you're going to help so many people. Now, Lynn, I want to come. Oh, go ahead.
We've got a couple questions I think can be answered pretty quickly. But what do you do if they parse out the whole bill, and how do you know when things should be bundled or individual?
That's a very good question. And again, we can help you with that. If you actually have a question, you could always email me. I can help you with that. But you can also Google that seriously. And you can just say, what type of medical procedure should and should not be bundled? You can look up the CPT code guideline book online, and you can see things that should and should not be bundled. And again, this is mostly with regard to surgical procedures, that type of stuff. A lot of times it happens with blood work. Labs. So let's say there is something called a Chem 7. Lynn, you're familiar with the Chem 7, and there's 7 identifiable tests. Well, if you see that your doctor ordered Chem 7, but then you say, oh, I'm being charged for this test and this test and this test and this test, that's considered unbundling. And that's just a matter of looking at, I hate to send people to Google, but it really is a good resource that you can go to find out any answer you want to find out. What tests, what lab tests are bundled and unbundled, or what surgical procedures should be unbundled and unbundled. Those types of things. And if in doubt, ask your provider. Ask your provider. Was this unbundled?
No, and that also I think is a good point. And what should things cost? How do you know if it's abuse that they're charging a lot more than they should? That is also something else that's Googleable. Would you say? Like, how much is the average thing this should be? This procedure should cost?
Yes, exactly. Now I am trying to work on a deal to give people access to this right there on their phone, but we use a database. And we are able to see a geo-targeted area. So if we put in your zip code, it will tell us within a 20-mile radius of what the average cost is for that procedure in your area. Because just like Starbucks, if you have a Starbucks on every corner, they could charge you whatever they want, although I think they're usually pretty close in price. But you can have hospital A, B, C, and D, and they could all charge different prices because it's not regulated. So in the meantime, there is a website, it's healthcarebluebook.com, and they're one of the folks I'm looking to work with, because you can go onto their website and put in, this is my zip code, this is the procedure I need to have done, where is the best place to get that price? And that's what we need to start doing, is shopping around for prices. We shop around for everything else. Yeah.
Absolutely love that. Josh, was there a second question you wanted to us to address quickly?
That was for now.
Okay. Perfect. Well, Lynn, I'm going to give you a 2-part question here, because, you addressed this a little bit earlier, but, I'm feeling pretty comfortable with what I got off the exchange. I feel okay with the price that I'm paying. But as you talked about the rate of rising healthcare costs. It's really concerning. So just because I have a good option now, while I'm a relatively low user of healthcare, doesn't mean it's always going to be that way. Like, what if they get rid of out-of-pocket maxes, or they change the laws about this stuff in the future? What would you say about this concern over the unknowns when it comes to the future cost of healthcare?
Yes, it's always really interesting to try to plan for an unknowable future and unknowable politics and such. The way that I look at this, every decision we make in life has to do with risk tolerance. And, I'm going to use an analogy with our house. So some people, when they buy insurance for their house, will have a high deductible plan or a low deductible plan for their house cost, because they're willing to take on, they want either a lower premium or a higher premium. And if we can use that analogy, I think a little bit with healthcare, with what risk are you willing to take, and how willing are you for the possibility of having to return to work? Some people are absolutely unwilling to have that possibility. And so they are then willing to work 10 years more to hedge against that. So it's a matter of how much risk tolerance are you willing to take? How much of a runway do you want to have? What is the trade-off that you're willing to make? For me, I was okay with returning to work. Work wasn't the bad guy. I wanted autonomy over my time. I wanted discretion over that. I wanted a long enough runway so that I could take off a year, like I did in 2019, travel around the world with my kids because life is short. And I'm really glad that I did that, with knowing that that could be a possibility. And I was okay with that because there is also a trade-off in our time freedom that we're making. So to answer your question in a more succinct way, it's for those in the FIRE community, which really is what my website is based for, is for the FIRE community. And then also entrepreneurs face the same issue. So we see a lot of those folks. Do you want to have a plan for now until 65 when Medicare kicks in? And do you want to have essentially no risk? Then you could calculate that you want to do your out-of-pocket max plus your premiums for that entire time, which is a really big sum of money. It is very unlikely that you would need to meet your out-of-pocket max for every year from now until 65, because that means that you have run up probably somewhere over $100,000 in medical bills. Are you okay with just calculating the deductible from now until 65? And we'll talk about after 65 as well. And where are you on the continuum of that? So what I'd love to do actually, and if any of you guys are out there making content on this, I have in my mind a mental calculator of high, medium, and low risk, but I'm not great at taking my data in my mind and converting it to an actual product. So if any of you guys are creating anything about like high, medium, and low risk for planning, for cost, and want to partner with me, or you're already creating it and you want to send it over to our crowdsourced database at hello@fihealthcare.com, that would be great. But it's a question of how much risk are you willing to take on? How much assurance do you want to have that you'll never have to work even like a yoga part-time job? And then calculate that out. And I would say plan for premiums always, plan for deductible most of the time, and plan for out-of-pocket sometimes. So is that?
Yeah. No,
Yes.
That's helpful. And what I'm really hearing from you, Lynn, is when we think about financial independence, we think of it as it's 25 times my yearly expenses. And that number that we're shooting for is so heavily based on the accuracy of our assumptions of what our yearly expenses are going to be. So as much as it's a risk in trying to guess what healthcare costs are going to be, it's a risk in guessing your costs in general, right? You know,
Yes.
I'm turning 34 this year. I don't know what my costs are going to be 30 years from now. I'm taking a really educated guess. And if I'm wrong, what's the worst thing that could happen? I pivot and I adjust as things come up, right? And so I kind of look at healthcare and health insurance as just another cost that needs to be assumed in your planning process to FI. So just one follow-up question for you, Lynn. I know a lot of people pursue financial independence or want to become entrepreneurs because they want freedom. You know, maybe they want to live a nomadic lifestyle and be able to travel around and do whatever they want. Like you traveled around for a year, right? But when you buy health insurance off the exchange, a lot of it is very specific to your geography. You know, I hear a lot of criticism that, well, if I buy my own plan off the ACA, I'm only really covered for providers in the state of Ohio for me, right? So what would you say to someone what are the options for someone that wants to, you know, really live it up and explore their freedom when they're not tied to W-2 work?
Yeah. That's a great question. And it's a particularly relevant one now. I think a lot of people are looking at getting out of the high cost of living areas, looking at relocating to different states or different regions of the same state or different countries even. And if you're thinking about staying in the US, what I would look at is, are there PPOs, preferred provider organizations, which means that often they'll have interstate contracts with other providers within other states. So that's one option that I see within the FIRE community. Often the premiums will be a little bit higher, but you'll have more flexibility in terms of what is within network. The other alternative I see often is health sharing ministries. Health sharing ministries is not insurance. It is considered donation based. It is an alternative to healthcare. And it is basically a group of people pooling their money together and paying it out. So there's not really contracts or in network or out of network. However, and the premiums tend to be lower. So, however, there are a lot of caveats to that. There are exclusions. There are a lot of places can't work with their billing. And so you'll have to often pay ahead of time and then negotiate it later. So there's a lot of pros and cons, and I outlined them on my website. So you guys don't have to remember all of them now, because I can't remember all of them, because there's lots of pros and cons to the health sharing ministries. But that is a common alternative. But I do have a lot of cautions about that for people to consider, that we just don't know the future of the Affordable Care Act, and because it's not considered insurance, it may be seen as being uninsured for that period of time. But I do see that often as an alternative for folks who are nomadic.
Yeah. What would you say about, let's say, medical tourism? I know that people talk about that. Like, what do you have to say about that?
Yeah. So medical tourism, I love this topic for certain things. So for medical tourism, that can work well. So that's when somebody goes to a specific place for a specific procedure. So there's a popular area in Mexico, and I think we even have Quinn on here, who has a surgical center in Utah. People go to a certain specific place for a certain specific intervention because it is a better cost. And that works well for things like possibly dental, possibly cosmetic surgery, things that you can plan for in advance that have a specific outcome. And there are a lot of medical tourism cautions, of course. You want to make sure that they are accredited. You want to make sure you've done all your due diligence. I have some of my favorite resources listed on the site also about medical tourism, specifically from other folks in the FIRE community who've done this. But you can't use it for managing chronic conditions. You can't use it for that type of thing.
Got it.
There's also separate travel type insurance, which is for US based folks who are traveling around the world. And that is going to cost less than anything else. The US has the most expensive healthcare in the entire world. We are at about twice the cost of any other industrialized nation. And sadly, the outcomes for most things that we see are not better. We're at just twice the cost and not a better care delivery. So the value is terrible in general. And that's really not disputed. There are some outcomes that we have that are better, but the vast majority, we're on par with folks who charge about half the amount. Wow. But that is good for traveling because what we'll see if we're sticker shocked with our price of healthcare here is the travel insurance tends to be very, very reasonable relative to what we see in the US.
Thank you, Lynn. Okay, so just a couple minutes left before we dive into some questions with Josh. Angel, I have to ask you, we've talked a lot about buying health insurance and addressing those big medical bills we're all scared about for the future. But what would you say to someone that has medical debt now? Is there anything they can do about the bills they're confused about that, it came in, let's say last year, they didn't know that they could negotiate. They didn't know how to check the codes and make sure there was no fraud or abuse. What advice would you have for someone that's dealing with medical debt now that maybe it went to collections or what have you?
Well, the first thing I would say is we lose bargaining power once we go delinquent. So if you have medical debt and you've been making payments, that's okay. It's at least let's keep you in the game kind of thing. So let's say your debt is still with the hospital or the provider, then I would first try to negotiate with them. Again, financial hardship or payment plan through them only. But then, because they just want money, that's what they want, not money. I shouldn't say it like that. They want to be paid for a service. And you've already, if you don't have time to go back and debate whether or not it was necessary, it's long past that window and you just have this bill now, you want to negotiate with them. If it's already with the debt collection agency, what happens, and this is something that I learned recently, is that the hospitals just want money. They want to get it off their books. They want to close their books. So let's make it easy. Let's say you owe $10,000 to the hospital. They want it off their books. So they're going to sell your debt to a debt collecting agency because they just want money. So they may sell your debt for $5,000 to them. just to get something, just to shut down your part of it. Now, the debt collection agency, they now bought your debt for $5,000, but they're going to come after you for $10,000 because they want to make a profit off of that. So if it's currently with a debt collection agency, negotiate with them. Go back to step one with them. Look, I can't afford it. Here's financial hardship. I'm willing to give you $20 a month or whatever you can do. But because they also want to shut their books. So that's what I'm saying. It's negotiable every single step of the way type thing. And I'm not saying to try and get something for nothing. That's not what I'm saying. But I'm saying if you really have, I mean, we have people who've spent months in the hospital with COVID and they're getting medical bills in the amounts of $1 million. That's going to be an albatross on their back for the rest of their lives. Well, let's negotiate that.
Yeah.
So yes, you can negotiate every step of the way, even with the bill collector, because the debt collector. And if you need help with that, I would try and find, because I know there are people out there who will help you with your credit score and wipe debt and all that. If you're going to work with somebody like that, two things: make sure that it's like a nonprofit, and also make sure that they are licensed to do that within your state. Because again, there's people out there trying to make money that way as well. We just want to find the ethical people in the world is what I say. So, and can I just add something to what Lynn had said about traveling? I advise everybody, if you go someplace on a regular basis, like my parents are snowbirds, they always go down to Florida. I say to them, make sure you know wherever you're going, who's in network, who's because they'll spend like a month or two there. So if you know you're going to travel out west every year to see your kids, or you're going to travel to a designated area, even if it's not for long term, look up ahead of time who's in network. Yes, it's prep work, but that's more important than figuring out where you're going to eat dinner over there, because this could cost you more than a dinner. And then I did see somewhere in the chat, somebody had said, what do you do if you're not conscious? You're in the hospital and you're unconscious. Have somebody go with you to the hospital. If you're in long term, even if you have to pay a friend, I'll take you out to dinner when I get out, but could you just come and keep track of everything that's going on? Like, which IVs did they give me? Which medications did they give me? How many times did the doctor come in? How many times how long did they spend with me? All that kind of stuff. I had a friend who's a chiropractor, and he spent 6 days in the ICU. And he said, darling, you need to let people know this stuff, because even as a medical person, if you're in the hospital by yourself with nobody to help you keep track of stuff, you're pretty much screwed, because there's no way to know what they're charging you.
No, it's a really good point. Really good point. And I just want to give, we're going to dive into questions with Josh. I know he's got some primed up for us, but one example is what I wanted to point out about medical debt. And when you get the big bill, this happened to me once when I was much younger. I got a bill for $1,000, and it was for a test that my doctor ordered that the insurance said wasn't medically necessary. So I was footing that bill, and I didn't know you at the time, Angel. So I wasn't able to verify and push back and do all of that. I just thought I had to pay this $1,000. But the thing about medical debt is that it doesn't carry any interest. Credit card debt is carrying a lot of interest, right? That interest compounds over time, and you end up paying triple what you owe for that, $12 purchase. You're paying triple now due to compound interest. Medical debt doesn't have that. And so what I ended up doing is I called and I said, I can't afford $1,000. And I paid them, I'm not kidding you, I paid them $20 a month until that $1,000 bill was paid off. Because why not stretch it out as long as you can? There's no interest that you pay on that. That is so much better than letting that bill go delinquent, and then it goes to collections, and now you've got people harassing you, right? Yep. So just pay like the tiniest bit every month. Okay, Josh, let's dive into some good questions that you saw pop up in the chat.
All right. So one that just popped up, and I really want to know, can they touch on how employees who lost medical coverage can extend their COBRA election until we're through the COVID emergency?
I can take that one. So when people lose medical coverage, that's considered a qualifying event. So you're asking about COBRA, and I'll get to that. But just so you know, that's a possibility for the basic health plan, healthcare.gov. So that, first of all, is an option for folks if they want to. But for COBRA, that is you're wondering about how to go about actually doing that. And that would be through your employer. I would start the process there through the employer to talk about extending that. But I would also run to see what the options are on the exchange as well and compare that. And if that doesn't answer the question, let me know in chat. But you should start with your employer or former employer. there and then kind of take their guidance. I also wanted to mention there are options outside of healthcare.gov, and you can get insurance through brokers. The cautions that I have with that is that there are sometimes things that are not included, and you want to make sure to know what those exclusions are. So the Affordable Care Act has 10 different major provisions that it requires people to have, which is like mental health coverage, maternity coverage, wellness. So you want to make sure if you're going through a broker to see if they are ACA compliant and if that's an issue for you. For some people, they're okay with that. But I do want people to take a look at that. Sometimes you will get lower premiums, but you'll get different types of coverage. And so it's not a judgment. I just want you guys to know what you're buying and what is going to be excluded. Sometimes you will also, if you're buying through a broker that's outside of the exchange, you will be, the pre-existing conditions clause may not be in effect. And you also may have to have some sort of physical ahead of time. So there's just a few different things to look at with regard to that I wanted to mention.
I think this is going to be a question for Diana, but a lot of people probably have this question. There's so much info in this webinar. Please let us know if we can get a recording after the meeting.
Yes. So when you registered for this, the recording should go out to you automatically after this. It's a webinar jam feature. So let's see if it works, but I will make sure that this is sent to you afterwards. I'm also planning on downloading it and adding it to my YouTube channel so that more people can see it.
All right.
And what's your YouTube channel? Because it's hard to find because of the spelling.
Well,
no,
okay.
I mean, the spelling's unusual.
So it's if you just search for Economy Conference, and economy is spelled with an M-E at the end, not an M-Y, because I am so clever.
Yes, you are. Can I address real quick? April had said about what do you do? Right now with COVID, people can't go into the hospitals and we're not allowed to have visitors. And yeah, the onus then falls on us. I actually had to be in the hospital just last month for the day. And my partner, he had to sit out in the car the whole day and waited. I kept texting him what they were doing. But yeah, the onus is on yourself to either keep tracking your note in the note section of your phone. And then when the bill comes in, if something's questionable, like, wait, did they really do that day? Request the itemized bill. You can always do that after. But yes, April, right now with COVID, it's a crap show right now with regards to healthcare and stuff out there.
April, I wanted to mention some things too from personal experience. Of course, my daughter burned herself pretty bad on a holiday. So everything's closed. I couldn't verify specific providers. The website wasn't working. I was just going to have to deal with what happened after. And it really is, if you start to ask, is this reasonable? I was not able to verify anything. What could I have done? And when you get your explanation of benefits, it'll tell you how to contest it and it takes some time, but if it's a matter of thousands and thousands of dollars, it may be worth it. And I encourage everybody to really be an advocate for their own healthcare costs. This is getting crazy. It's a bizarre system, but it's really amazing if you approach them from a reasonable perspective to say, I've done the best I can. You know, what could have been expected? Eventually, they most times are reasonable in my experience.
I agree. And I want to piggyback off that too. One of the things, Lynn, we learned in school, nursing school, is that people not only want to help people that they like and that are nice, but people don't sue people that they don't like. I mean, people don't sue people that they like. So we just want to treat everybody with kindness because you know what? The person on the other side of that phone, they're having a bad day. They have medical bills. They're dealing with all the same stressors we are, where their family can't see them if they're in the hospital, all this kind of stuff. So I always come at it from a place of, I know you're doing your best and so am I. And what can we do here? Like always come from an empathetic position for them and they'll return it to us because people really do want to help people. They're just trying to do their jobs. Even the debt collectors are trying to do their jobs. So
yeah, can you imagine a worse job? I mean,
No.
I found that very true. You're reasonable. They have to deal with this all day. And if you're a reasonable person, but trying to figure out a problem, I found very good success with that.
Mm-hmm.
All right. Do you have any suggestions if I use primarily alternative practitioners like naturopaths, chiropractors, etc.?
Yeah, that is, we didn't even, and I'm sure that Angel has some thoughts too. We didn't even dig into a lot of other options for folks. Prevention is right in there. Just like when you buy home insurance, you also don't want to invite termites into your home just because you have great insurance. There are a lot of levels to healthcare prevention, treatment, cost. But as far as actual coverage, there is something called direct primary care, which can be good for folks who consider alternative care or who want to have, so it's called DPC. And a lot of providers are in that space. It's kind of a new area. I think Pete, you guys know him as Mr. Money Mustache, is doing an experiment on that. And there's a link. I don't know, Josh, if you're able to put that in about his experiment with DPC. And for folks who do alternative, I recommend that they look at maybe like a catastrophic plan so that they're running most of their care through the alternative route and get sort of a catastrophic plan so that they can bulk up their HSA and have something in case of something really bad, in addition to their first layer with their alternative provider. And the term alternative is very interesting because it's really often, tens of thousands of years of medicine actually that we consider alternative. But yeah, Angel, more thoughts?
Well, I'll tell you something that I am newly interested in. Diana introduced me to her aunt. There's practitioners out there called functional practitioners. Mm-hmm. And we have a healthcare system that is really focused on sick care. They just are treating symptoms. They're treating symptoms created by our lifestyles and our diet and the food that we eat and all of that. So they're just basically patching. Functional medicine practitioners, they actually, so this is one area, you were asking about different providers, where they look at the root cause of what's going on in your life, your stress, your emotions, everything that's playing into what you're dealing with right now. And then they address that, which I really do. I like that kind of mindset shift. And the other thing I was going to say, and it slipped my mind about, so what I want to help people with right now is their medical bills. That's their pain point. That's what y'all are dealing with. And that's what I want to help you with. But then more power comes when you're more empowered and have autonomy in the provider's office. But my end goal, like Lynn was just saying, primary, secondary, and treatment, I want to empower all of us to never even need the healthcare system. Let's take ownership, not just ownership of our finances, but let's take, when it comes to medical bills, but let's take ownership of everything that encompasses our freedom, which is our wellness, our mental, our physical, and all that kind of stuff. So that's where ultimately we want to get to. We are in total control of our lives, our money, our time, absolutely everything. And we are not dependent on the other systems any longer, which is what the whole FI movement's about, right?
Absolutely. Mm-hmm. Absolutely.
Yeah.
Talk about tying that all together. I didn't even plan that.
Exactly. Hey, and that's actually a perfect segue for this next question because he's already hit FI, but he's concerned about costs because of a pre-existing condition. Well, what's the best way for someone in remission to find affordable health care?
I can take this, Angel, if you're...
Please, yes.
So right now with the Affordable Care Act, aka Obamacare, aka what's provided through the health marketplace, you don't have to be concerned about pre-existing conditions. That is one of the legal protections that is now afforded through that act. And that actually has bipartisan support, Democrat and Republican, that the majority of the population would like to have healthcare options that are not subject to pre-existing conditions. And it will be very interesting to see if, I think COVID will be considered a pre-existing condition. And I think a good portion of our population, because they're seeing effects of it in the body throughout the entire body system. So it's going to be really difficult to extricate what exactly is the outcome of that eventually. But to answer your question, going through the general marketplace, I'm going to just so you guys who don't already know me, I run this website. I don't charge for it. It is a complete money sink. It is the worst business plan ever. I am not an advocate for the government. I do this because it frustrated me and I made this database and people wanted me to make it public. So just to put that out there, my motivation is because I'm frustrated and passionate. Eventually, I'm going to convert it to a nonprofit probably in 2021. But anyhow, if you go to the general, either Health Sherpa or healthcare.gov, you should be able to find your plans there and they won't be subject to the pre-existing condition clause.
Well, thank you so much. I'm sure, Josh, that I'm not paying attention to the chat. There's probably a ton more questions, and maybe we will have follow-up webinars. Maybe we'll find opportunities. We are going to send everyone's contact information. Also want to let you know that for signing up for this webinar, you are now on all of our mailing lists, on my list, on Angel's list, on Lynn's list. So if you want to opt out of those mailing lists, that's totally fine, but it's a great way to keep in touch with us, to continue asking your questions and getting more information on this incredibly important topic. So to close us out, Angel, can you please let us know where people can find you and how people can keep in touch with you aside from the mailing list?
And I have to tell you, the site is live.
Okay, fantastic.
God. Guys, I dreaded that question because I've been working, tech is not my thing. And I've been working on it for a month, and they promised me it would be live last night. I woke up this morning, it wasn't live, but thank you, Josh. So my website's live. They can go to overtookconsultants.com. And also I'm starting a YouTube channel where I'm going to be doing live videos. It's just my name. You can look for that. And then you can also follow me on Facebook, my private page. And I tend to go on there once a week with some just helpful tips for my family and friends, that kind of stuff. But you're all now familia. So feel free to join me there too.
Amazing. And Lynn?
Yeah, the best place to find me is fihealthcare.com. You can send me an email at hello@fihealthcare.com if you have found helpful things that we should add to the database. For those who want access to the database, this crowdsourced database, the password is community. I give it away at entry, but people don't always look up there. Eventually, I might close that, but the password is community. And I'm also on Facebook sometimes. I'm on LinkedIn sometimes, and I'm sometimes on Instagram. But yeah, I look forward to connecting with you guys there.
Amazing. And you can find me at Economy Conference. And remember, Economy is M-E, economyconference.com. We are really gearing up for our next event, which is happening on March 13th and 14th of this year. Tickets are going on sale on March 7th. And
you misspoke there. The event is going to be November 13th and 14th.
Yeah. You said
What did I say?
You said March.
March. You're getting too excited.
I'm getting too excited. I want
girl.
it to happen tomorrow. Yes, the event is happening on November 13th and 14th. Tickets go on sale March 7th. And those of you who know Lynn know that she spoke at the first event last year, and I'm so thrilled that Angel is going to speak at the next event. So if you loved her on this webinar, you got to see her on the main stage because she's going to be incredible. So it is, early bird pricing is $149. We are only offering 200 tickets at that price. It will then go to full price after April 10th. So March 7th is an important date because it is actually the 1-year anniversary of our first show. And then April 10th is an important date because it's my birthday and I want ticket sales for my birthday. So 200 tickets are being offered at that very special price for about a month. And then afterwards, full price is $199. Now you're on my mailing list. I will be putting out additional information on who are the speakers, what is all the programming. It is going to be absolutely incredible. We are expecting to sell out with 700 people for this party about money. That's how we like to describe the Economy Conference. So we really hope to see you there. And I think that's a wrap for us today. Any closing remarks, anyone?
I plan to be there.
Tell us where is the conference? We just had somebody ask.
Okay. The conference is at the University of Cincinnati. It's an amazing venue.
Can't wait.
It was so awesome. It was my favorite weekend of 2020.
Yeah.
So great. All right. Well, thank you so much, everyone. We are so thrilled to have you here, and keep in touch. Bye, everyone. Have a great Saturday.
Bye, everybody. Thank you.